If you're enjoying this MedPrep to Go Step 1 podcast, you can now get the content along with the content of the Crush Step 1 podcast ad-free in one bundle. Just go to medprep2go.com and find our new subscription podcast called MedPrep to Go Step 1 Bundle.
When the holidays start to feel a bit repetitive, reach for a Sprite Winter Spiced Cranberry and put your twist on tradition. A bold cranberry and winter spice flavor fusion, Sprite Winter Spiced Cranberry is a refreshing way to shake things up this sipping season. And only for a limited time. Sprite. Obey your thirst.
This episode is brought to you by Indeed. You're ready to move your business forward, but first, you need to find the right team. Start your search with Indeed-sponsored jobs. It can help you reach qualified candidates fast, ensuring your listing is the first one they see. According to Indeed data, sponsored jobs are 90% more likely to report a hire than non-sponsored jobs. See the results for yourself. Get a $75 sponsored job credit at Indeed.com/podcast. Terms and conditions apply.
Every who down in Who Newville liked the holidays a ton. But where to get great prices on gifts, they had no idea. None. They searched and they searched for great gifts under $25. Gifts for spouses and friends and even their toddlers. When suddenly one who shouted, Walmart has what you want, knowing they have Lego, Tree Hut, and low prices to flaunt. So they enjoy the holiday season as Who's often do. Cheering and shouting, Walmart has incredible gifts. Who knew? Find gifts they'll love under $25 at Walmart.
Hi, I'm Dr. Raj, and today I'm recording for the MedPrep to Go podcast, and I am super pumped up on this podcast. And what is it all about? Well, I'll be reviewing USMLE Step 1 questions. And today's topic, I gotta tell you, I'm always pumped up for it. It's going to be biochemistry. Yeah, I saw that look on your face. You're not as pumped up as I am, but hey, they're definitely going to ask these questions on the board exams. There's no way they're going to overlook glycolysis and gluconeogenesis and the Krebs cycle, And today we're going to be reviewing 2 questions on this podcast. Just 2. Usually we do 3, but today these are such special questions that it's going to take up most of the time. But for more questions, go to our website, which is medprep2go.com. It's a free audio and online question bank. And to learn more about me, Dr. Raj, hey, check out my website, which is beyondthepearls.net. Check out my podcast, which is Beyond the Pearls. What a surprise for the title. Check me out on social media. I would love to meet everyone. I'm on all different platforms. And I do have lots and lots of books. My 2 main series are a clinical series called Morning Report Beyond the Pearls, great for Step 2 and 3. I also have a basic science series called Case Reports Beyond the Pearls, awesome for USMLE Step 1. Let's get started. So we have a 23-year-old man presents to the clinic within a medical compound in Nigeria. The compound is running a trial looking at whole genome sequencing of pathogens in suspected infectious disease. He presents following a 3 months of feeling hot and sweaty at night, and he has recently noticed weight loss. Describes his trousers are now slipping down to his hips. His medical history includes HIV, which is treated with amtricitabine. Wow, I gotta tell you, these HIV drug names are tricky. Amtricitabine and tenofovir. He works as a local farmer. Physical exam reveals a thin, somewhat ill-appearing man. A sputum sample is obtained, and a Zeal-Nielsen staining shows acid-fast bacilli. That can't be good. Whole genome sequencing shows a mutation in the RPOB gene, causing a change in the binding site of RNA polymerase, leading to a change in antibiotic prescription due to a concern of resistance. To which of the following antibiotics is this pathogen most likely resistant to? Is it going to be A, beta-quiline? That's spelled Bedaquiline. B, ethambutol. C, isoniazid. D, pyrazidamide. E, rifampicin. I usually just call it rifampin, but on the question it says rifampicin, rifampicin. So really, what does this come down to as a question? Memorizing. There's going to be a mutation in the RPOB gene. Which of the following would it most likely be resistant to? So the right answer is going to be E, rifampicin. Rifampicin inhibits RNA by forming a stable complex with RNA polymerase. RPOB is a known rifampicin-resistant gene with mutations preventing an RNA polymerase rifampicin complex. Therefore, changes in RNA polymerase, as described here, likely prevent rifampicin binding and preventing its effect. Betaquilin is a newer anti-tuberculous drug and inhibits mycobacterial adenosine triphosphate synthase. A resistance to betaquilin is increasing, but the mechanisms of resistance are not yet clearly defined. Changes in RNA polymerase are unlikely to impact betaquilin function. Ethambutol works by binding to and inhibiting enzymes that form the cell wall. Changes in EMB capital B gene, so EMBB gene, alter the structure of enzymes that ethambutol binds to. Changes in RNA polymerase are unlikely to impact ethambutol function. Isoniazid, which is INH, is a bactericidal antibiotic that works by inhibiting TB cell wall formation. The KATG, CATG, is the gene that encodes catalase peroxidase, which activates INH, which is given as a prodrug. Variants of KATG prevent activation of INH. Changes in RNA polymerase are unlikely to impact INH function. The mechanism of action of parasitamide, choice D, is unknown. Resistance occurs largely in the PNCA gene, which encodes the parasitamidase enzyme, and that is referred to as the PZASE. The PZASE activates parasitamide. Changes in RNA polymerase are unlikely to impact parasitamide function. Let me just throw a couple things in here. Remember that if someone is suspected to have TB, and I'm looking at the question one more time, that he's feeling hot, he's having night sweats, he noticed some weight loss. If you suspect, and of course he's at a high risk, he's immunocompromised, has HIV, he's from Nigeria, where unfortunately there is a lot of tuberculosis, that the first thing is always going to be protect yourself and protect others. So these patients need to be isolated. You need to wear an N95 mask, be put into a negative pressure room. And of course, how do you diagnose? I got to be honest with you, we don't do these gene sequencing. It sounds great and accurate for a USMLE step 1 question, but we don't do these things commonly, unfortunately. But I do say that we are worried about resistant tuberculosis. Of course we are. But I do want to say that how do you diagnose, TB? That you definitely need sputum. Hopefully they're going to be making the sputum. So if they make sputum, great. If not, you can do an induced sputum. If you can't even induce the sputum, sometimes we have to do a procedure called bronchoscopy. But the take-home message is, what do you do with the sputum? Well, I usually send the sputum for 3 things. Number 1, I will send the sputum for a stain, also known as a smear, to see if it's going to be acid-fast positive. Just because you have a positive acid-fast stain or smear doesn't mean it's TB. There are a lot of other bacteria that can be AFB positive, and not everything has to be Mycobacterium TB. There are other Mycobacterium too that can be acid-fast positive. So not only do I send it for a stain and smear, and if it's positive and it turns out to be TB, that means you're very infective, but I'll also send it for culture. And definitely during the culture, I could do antibiotic susceptibilities, which is very important. TB is a slow-growing mycobacterium, so the culture won't grow right away. And the last thing I'll send with the culture is a Mycobacterium TB PCR. So if you get the Mycobacterium TB PCR positive and AFB stain smear positive, well, hey, that's going to be a slam dunk diagnosis of TB. Even though this is a biochemistry question, you definitely want to think about the side effects of all these TB drugs, including INH. And of course, if you don't give B6 vitamin, you worry about neuropathy, you worry about developing a sideroblastic anemia, you worry about toxicity to the liver. When I think about, things like rifampin in the rifampin family. Of course, rifampin classically loves to cause secretions to turn that orangey red. Ethambutol has a lot of eye toxicity, including optic neuritis. So very important. And of course, pyrazinamide, we don't want to give those to pregnant women. So all these things are important for the board exam. So I took the biochemistry question. If you don't mind, I added some of Dr. Raj's wonderful pearls on top of this.
Oh, Hilton stay, your beds are soft and cozy. No lumpy couch, no stiff futon, no shower line at crack of dawn. Oh, Hilton stay, a holiday you're saving.
When you want holiday comfort you can count on, it matters where you stay. This season, enjoy spacious, comfortable rooms and friendly service when you book with Hilton instead. Hilton for the stay.
Hey, this is Bill Simmons from the Bill Simmons Podcast, here to tell you that Michelob Ultra, the official beer partner of the NBA, is bringing NBA fans closer than ever this season with chances to win great prizes, including courtside tickets. Enter now at michelobultra.com/courtside. Michelob Ultra courtside 25 to 26. No purchase necessary. Open to U.S. residents 21 plus. Begins on October 1st, 2025 and ends on June 30th, 2026. Multiple entry periods. See official rules at michelobultra.com/courtside for free entry deadlines, prizes, and details.
So our last question today is going to be a 4-year-old boy is brought to the pediatrician by his mother because of concern that he has been exhibiting self-injurious behavior. Now, this is a slam dunk. This is going to be buzzword central, self-injurious behavior, 4-year-old boy. She states that for the past several weeks, he has been chewing his lips, biting his fingers. They have attempted to redirect his behavior without success. He has also been complaining of pain in both knees and both ankles. Past medical history is significant for speech delaying. Deficiency of which of the following enzymes is most likely responsible for this patient's condition? Now, I'm going to guarantee that this is 1,000,000% going to be on your board exams, meaning the USMLE Step 1. Very fortunate that this is not a common condition. And what is the condition, by the way? I know you know this. This is Lesch-9 syndrome. It's rare, but they definitely want you to memorize a lot of these biochemical enzymes. And they love asking questions about which of these diseases is associated with which of these enzymes. Choice A, alpha-glucosidase. Answer choice B, galactose phosphate uridyl transferase. C, hypoxanthine guanine. Answer choice D, muscle glycogen phosphorylase. So the correct answer here is definitely going to be C, hypoxanthine guanine phosphoribositol transferase, the HGPRT. These names are so hard to pronounce when you're trying to record a podcast. Lesch-9 syndrome is a congenital deficiency in the HGPRT enzyme. Lesch-9 syndrome is an X-linked recessive disorder, so it presents in young boys. Affected individuals are unable to salvage guanine or hypoxanthine using the purine salvage pathway, and this leads to increased PRPP and an increase in de novo purine synthesis. This then leads to increased purine turnover and hyperuricemia, which is going to be super, super, super important because class, listeners, learners, if you have high levels of uric acid, what type of arthritis are you predisposed to? It's going to be gout. So patients with Lesch-9 syndrome present at an early age with neurological features of self-mutilation, spasticity, cognitive deficits. Uric acid crystals can be found in the diaper sometimes. Sometimes they have an orange color to them. Although there is no cure, treatment with medications such as allopurinol, and who could tell me what enzyme does allopurinol inhibit? Why you folks so awesome? It's xanthine oxidase. Who can tell me another drug that's a xanthine oxidase inhibitor that we use in gout patients? Oh, you guys are amazing. Fluvoxostat, very good. And so allopurinol and fluvoxostat can decrease the uric acid, but it does not alter the neurological symptoms. I mean, I'm just very grateful that Lesch-9 is very uncommon. It's very rare. Choice A, alpha-glucosidase is incorrect. Alpha-glucosidase deficiency results in Pompe syndrome, which presents with feeding problems, poor weight gain, muscle weakness, floppiness, and a head lag in the first months of life. Answer choice B, galactose phosphate uridyl transferase is incorrect. Deficiency of galactose 1 phosphate uridyl transferase causes galactosemia, in which an infant is unable to metabolize galactose and must be placed on a galactose-free diet. Galactosemia may present with severe and persistent jaundice, vomiting, diarrhea, electrolyte imbalances, and weight loss. And last is answer choice D, muscle glycogen phosphorylase is incorrect. Muscle glycogen phosphorylase causes McArdle's disease, a rare muscle disorder in which glycogen cannot be broken down. This can present with fatigue, muscle pain, muscle cramps within the first few minutes that occur during exercise. There is a learning point to this case, which is Lechstein syndrome results from a congenital deficiency of hypoxanthine guanine phosphoribosyltransferase, the HGPRT, and results in neurological issues, including self-mutilation, spasticity, cognitive defects, and don't forget, they get the arthritis known as gout. I hope you folks enjoyed today's lecture. I kind of gave my own Dr. Raj beyond the pearls on top of the questions. And to get more questions, like I said, go to our website, www.medprep2go.com. I'll see you folks again during another MedPrep to Go lecture.
Hi, everyone. This is Ted O'Connell. I just want to let you know that we have launched a Step 2 QBank podcast, very similar to our Step 1 QBank podcast. Each episode will have 3 questions so that you can study on the go. We are actively recording these and plan to release a new episode every 2 weeks. We're also launching a premium podcast bundle that will include ad-free access to USMLE Step 2 Secrets podcast, as well as early and ad-free access to all of our episodes from the Step 2 QBank podcast. So please go over to our website at medprep2go.com and check these out, or you can access them wherever you get your podcasts. Thanks so much.